So I would like to begin the afternoon by acknowledging that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups. Respectfully, we acknowledge the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. So my name is Georgia Darmonkow, and I'm a medical student at Memorial University, and am president of the Doctor of Medicine class of 2024. So in other words, that just means I'm finishing my second year of the 4-year MD program. So I would like to extend a welcome to the following people: the Honorable Dr. Andrew Furey, Premier of Newfoundland and Labrador; Dr. Susan McDonald, President of the Newfoundland and Labrador Medical Association; and Dr. Margaret Steele, Interim Provost and Vice President Academic and Dean of Medicine at Memorial University. So today, we have gathered for a very special announcement regarding the Doctor of Medicine program at Memorial. So I would like to take this opportunity to invite the Honorable Dr. Andrew Furey to come forward and provide remarks on behalf of the provincial government.
Thank you, Georgia. It's certainly an honor and privilege to be here today. I certainly feel like I'm at home, and when I came in and saw Georgia here, Georgia used to do research in the orthopedic clinic for us, so it's an extra highlight that I feel like I'm at home here at Memorial University, and specifically at the Med School of Memorial. So it's a pleasure to be here. I grew up here, I worked here, and I'd like to continue to remind Dean Steele that I'm a tenured associate professor here if the other job doesn't work out. So, look, we know there are challenges in our province's healthcare system. We haven't been ostriching on this. We recognize this. We know that, if we're all being honest with ourselves, that they existed before COVID-19 as well. But we also, of course, are living the impact that COVID-19 has had on the healthcare system. Issues in our healthcare system are part of why I wanted to make that transition from medicine to politics, to work to improve them. For the dedicated professionals I work alongside of, I see Barton Thiessen in the background there, who is a fantastic anesthetist, who I really loved working with every day and miss working with you as well, Barton. But not just for myself and Barton and other doctors in the room, Dr. McDonald and others, but for the future ones. And the future doctors, the future of the province, of people who care for Newfoundlanders and Labradorians. Time and time again, we hear the difficulties in retaining doctors, especially when it comes to our rural coastline and areas around the province. As jurisdictions across the country and around the world face the same difficulty, a human resource one. We are all competing with each other for those that are already trained in the profession of medicine. Our government continues to work closely with all stakeholders on how to best address recruitment and retention issues that are unique to the province that we love. We're all dedicated to improving access to care and to improving working conditions for all our healthcare professionals. And I think we are making some progress. For some time now, we've been using a number of measures to try to find new and creative ways for both delivering services and finding solutions to the unique problems of Newfoundland and Labrador. Solutions to help bring physicians to our province and encourage the ones that are already here to stay here. Through our collaborative team approach, we've continued to open new clinics, which include physicians, nurse practitioners, and other healthcare professionals like physiotherapists and psychologists, to ensure that you receive the right care from the right person at the right time, and every professional is working to their full capacity. We launched 2 new pilot projects to attract more medical graduates to family practice, expanded virtual care, established a provincial health professional recruitment and retention office, took the extra step of making sure that there's a new Associate Deputy Minister for recruitment of healthcare professionals in our province. We facilitated immigration pathways for international healthcare professionals and graduates. And just yesterday, we announced that Dr. Pat Parfrey is taking on a new role as Deputy Minister of Health Transformation for the province. Today, I'm very pleased to announce yet another measure that we are confident will further support physician recruitment and retention in our province. Today, we are adding 5 new seats to the undergraduate medical education program at Memorial University, specifically for Newfoundland and Labrador residents beginning next fall. This is great news for our province, and I can tell you as a former medical student, I'm sure it's great news and will have an exciting moment for all undergraduates across the road as they embark and want to embark on what is truly a special career. We know that graduates of Memorial University's medical programs are very inclined to stay in Newfoundland and Labrador, and they want to live and work and play and raise a family and reach their professional goals here in our province. It's a very special thing that we have here, a way of life that makes it an attractive place to live and work for newcomers, as we know we've grown up here and recognized it all our lives. We know it's not hard to make new friends around here, and that's what drives newcomers to come here and stay here. So just to give you an idea of how these new seats will work, right now there are 60 seats reserved for residents of Newfoundland and Labrador for this 4-year program. With these additional 5 seats, 65 of the total 80 students that are accepted annually to the program will be from our province. We all know that research shows that students who study and complete their medical education in their home province have a higher rate of staying in the province and practicing as a physician. Increasing the number of reserved seats for students from Newfoundland and Labrador will offer an opportunity for more learners from this province to study medicine right here at home. It's our hope that these new seats represent 5 more potential doctors, year after year after year, who will choose to live and work and care for the people of Newfoundland and Labrador. I want to reiterate that our focus remains on the continuous improvement of healthcare and the healthcare system, in conjunction, of course, with our stakeholders, and I recognize Dr. McDonald, who's been a good partner in this venture, and the NLMA, that supports our healthcare professional workforce and ultimately drives better outcomes, which is what we are all after for Newfoundland and Labrador. This is all in keeping with our government's commitment to change the delivery of health care in our province for the better, to reimagine the healthcare system with incredible input from people in this room, stakeholders across the province, and with a framework that has been highlighted from Health Accord NL. I'm excited by the progress we have made in the last year alone, thanks to the tireless work of the Health Accord NL, Minister Haggie, and his team in the Department of Health, the health authorities, and everyone who continue to provide care during tough times in the pandemic and extra tough times because of the crisis in the healthcare resources. Thank you for that work. Please know how strongly you are valued here in Newfoundland and Labrador. And I know there's a number of providers in the room, so let me speak directly to you for one sec. We know the challenges that you face. We hear you. We're listening. We want to work with you. We realize that there needs to be short, medium, and long-term solutions to the challenges that you face every day, to the stress and anxiety that causes in you and your practice, and therefore your patients, every single day. Now, these solutions, they don't grow on trees. They won't happen overnight. But it's steps like this to increase our capacity, to recognize that the practice of medicine has changed, and we need to change as a system to ensure that we're keeping up with the changing times. So you're valued. We appreciate your voice. We want your voice. There's nothing in me that has suggested that we are ignoring the issues that we are facing. But we have to be creative and own the solutions moving forward so that we can reimagine the healthcare system that was built in the 60s for ones that Newfoundlanders and Labradorians deserve today in the 2020s and beyond. Thank you.
Okay, well, thank you, Premier Furey. We very much appreciate having you here today, not only as Premier, but of course as a Mun Med alum as well. So I would now like to invite Dr. Margaret Steele, Interim Provost and Vice President Academic, as well as Dean of Medicine, to provide remarks on behalf of the Faculty of Medicine.
Thanks very much, Georgia. I was delighted you agreed to be MC because our best ambassadors are actually our students. So thank you very much. So good afternoon, everyone. I would like to extend my welcome to the Premier of our province. And as you heard, he's alumni 2001 and a tenured faculty member. So we're delighted for your support and remarks on behalf of the provincial government and the Minister of Health, the Honourable Dr. John Haggie. I'd also like to welcome Dr. Susan McDonald. As you heard, she's the president of NLMA, but she's also an associate professor tenured in the Faculty of Medicine. So recruitment and retention of physicians in our province is of great importance. And as the only medical school in the province, we recognize the role the medical school has to work with the government of Newfoundland and Labrador and communities throughout the province to ensure we can educate competent and compassionate doctors who will be prepared to work across the province. Memorial University's Faculty of Medicine's mandate includes providing excellence in medical education that will ensure all medical learners are prepared for their next stage of training or career advancement. This includes providing learners with active, engaged, empowering, and authentic community-based experiences. As you've heard, research shows that not only do students who do their training here, but who have grown up in a province are more likely to stay here. So it's so important to have these additional seats for people in Newfoundland and Labrador. Memorial's Doctor of Medicine program has a proven track record in recruitment and retention of physicians for rural and underserved populations. We have been nationally recognized as leaders in medicine when it comes to producing rural doctors. There's an organization nationally, the Society of Rural Physicians of Canada, who's the national voice of Canadian rural physicians. The organization annually recognizes a Canadian undergraduate medical program which has excelled in producing graduates headed for a career in rural medicine in the Canadian Resident Matching Service program. This is known as the Rural Medical Education Award, and Memorial University has received this 4 times since 2008. The Society of Rural Physicians of Canada also recognizes a medical school for excelling in producing family doctors who practice in rural areas 10 years after graduation, and this is called the Keith Award. And this year was the 9th time that we received that award, and 4 times in the past 5 years since I've been dean, so I'm very proud of that accomplishment on behalf of our programs. So on behalf of Memorial University and its Faculty of Medicine, I would like to extend my thanks to the Government of Newfoundland and Labrador for their commitment to advancing medical education as we work together to help meet the needs of the communities throughout Newfoundland and Labrador. Thank you.
Thank you, Dean Steele. So as always, your leadership and passion for medical education truly are inspiring. So from my perspective as a person who was born in Newfoundland and now as a Newfoundland medical student, it's absolutely wonderful to hear that more students from Newfoundland and Labrador will have the opportunity to study medicine here in our province. So it's probably no secret that the admissions process is grueling and competitive. And honestly, I'm thankful that that part is over for me. And so many of us dream of one day becoming doctors. Having 5 additional seats designated to 5 amazing individuals from this province certainly helps to achieve that goal. So as both Dean Steele and Dr. Furey mentioned, research shows that people who are trained in their home province have an increased likelihood to stay and practice there. So while I may not have research behind my comment, it is certainly my opinion that humans are creatures of habit, and there's always an emotional pull for Newfoundlanders to stay in Newfoundland. So I also think that ultimately these 5 seats will translate into helping patients in all corners of this province. And honestly, I can't think of practicing anywhere else. So with that, we will conclude the formal portion of this announcement. And I invite Premier Furey and Dr. Steele to come forward once more for a photo.
You should just handle it.
Yeah. And they will be available for questions and interviews. So thank you all so much again for joining us today for this exciting piece of news.